Hello and welcome. My name is Dr. Calliope, and I'm going to be performing your scalp check today. Do you mind if I just grab your name real quick? Let's see. Excellent. And is that the name you prefer to go by? Very good. And what about your date of birth? Excellent. Wonderful. So, before we get on to the examination, I just want to ask you a few questions, if you don't mind. Okay? Firstly, are you experiencing any current pain or illness at all? Okay. Very good. And any changes to the medical history that we have on file? Excellent. And what about your family history? Very good to hear. Any changes to your allergies at all? All right. And what about your medication list that we have here? Any changes to that at all? Very good. Excellent. So, what am I seeing you here for today? Okay. Let me just write that down. Okay, very good. So we'll take a little look at your head, and I will just from time to time ask you questions regarding how you treat your head and your hair, okay? Very good. So let me set this down. And I'm going to sanitize my hands real quick. Very good. Absolutely gorgeous weather outside, isn't it? Yes. Warm sun, gentle breeze, birds chirping, just beautiful. Excellent. So I'm going to pop on a pair of gloves, and then we are going to start your scalp examination. First, I'd like to ask, is it okay that I touch you for this examination? Do I have your consent to do that? Wonderful. So let me grab some gloves. So hopefully these will slide on just quickly and smoothly enough. My hands tend to run on the sweaty side, so sometimes it takes a bit of wrestling. There we are. So we're going to start first by just brushing out the hair, giving it a nice little comb over. There we are. So let me see here. All right. So I'm going to start with a round brush here, and I'm just going to be very gently brushing the hair, just generally detangling the hair. There we are. So, firstly, how often do you wash your hair, would you say? Once a day, once every other day, once every few days, once a week? Anything longer than that? Okay. And do you feel that that has worked well for you so far? You haven't noticed any excessive oiliness or dryness, have you? In either the scalp or the hair? Okay. So if you're having some dry scalp issues, that certainly could be a contributor if you're washing your hair rather often. Now I'm going to get a comb with a wide tooth to it, and we're just going to comb the hair again. This helps to make the hair very manageable, as well as just generally relaxing our patients as we take the time to just slow down and take care of them. There we are. So right off the bat, your hair is very manageable. So that is a good sign that it is very healthy. If it tangled really easily, that could be due to the hair texture, but it also can be due to the hair's condition. Here we are. So what kind of products are you using to wash and condition your hair? Okay. About how long have you been using those? Very good. And you like those? Okay. Do you use any other sort of styling products or any other sort of product on the hair? Whether it's hairspray, leave-in conditioner, hair masks, gel, any other styling aids like hair wax, pomade. Okay. Alrighty. And do you use any styling tools? Any hot tools like straighteners or curling irons, anything of that sort? Okay, I see. So it sounds like overall you take very good care of your hair, and it does show. It's very long, and the hair itself is well hydrated, I would say. Maybe just a touch of dryness. But there aren't many split ends. Overall, the hair just looks relatively healthy, which is what we like to see. Have you noticed any scaling or dry patches, oily patches, any redness, irritation, itching, anything ringing a bell? Okay. Alright, so as I inspect the head, I want you to let me know if you experience any pain or discomfort. So I'm going to get a comb with a sharp end here, just so I can part the hair and examine each little bit of the scalp. And I have some pins and some ties if I need to pin back the hair. I also have a magnifying glass for a more detailed inspection. So I'm going to start off with just parting your hair down the middle. It's going to be a lot of hair brushing, a lot of hair combing here. And let's see, so your part seems to be trained really well as your hair doesn't want to really go the other way, which is fine. I know I've tried to train my part for about a decade now, but it just does not want to stay on the side. I'm just going to start here by just very generally taking a look at the scalp. If I see anything out of the ordinary, then I can grab our magnifying glass Here's little Wiley. There we are. Very good. So far, the only thing really that I'm noticing is a bit of buildup, and that can be due to either your environment or your products, or sometimes it's just due to not rinsing out the hair enough. So what you can do is use a clarifying shampoo. That can be quite drying though, as its aim is to remove buildup on the scalp. So I would use that at the most, perhaps once a week. If you color your hair, it also will pull the color out quite a bit, so just be mindful of that. Maybe do that right before you color your hair, so that you're not pulling out fresh color. Can be a little stripping, so it might be a good idea to follow up with a hair mask as well. And so far, looks fairly normal. At the end, we'll give you a nice brush through once more so that you won't leave the office with crazy hair. Might be time for me to start bringing out either our pins probably manage until we get to the ear. And I'll start sectioning the hair a bit better. There we are. Very good. How is everything feeling so far for you? Okay, feeling okay. Say for the build-up, there's not really anything that I'm noticing. And lots of people deal with product buildup on their hair, especially people who use a lot of product. I don't know if I mentioned this, but you can also use a scalp massager tool when you are washing and rinsing the hair. They generally are made of plastic and silicone, and they have little nubbins on them so that they gently scrub the head without injuring you or hurting at all. You just have to be careful not to go too vigorous with that. You have any super cool plans after this? Yes, I think enjoying the day sounds wonderful. I think after work, then my partner and I will probably grill up some food for supper. And perhaps take a nice little walk around the neighborhood. May also just hang out in the sunroom. The sunroom, when days are like this, oftentimes gets up to about 78 degrees Fahrenheit, which feels balmy as opposed to the 50 degrees Fahrenheit outside. So we'll see. We will see. Right. We're getting to the part where the hair does not want to part as much anymore. Closer. Alright, I'm going to part your hair normally again, and then I'm going to take a look at sides a bit more, and we'll take a look at the back of your head as well. Okay? Excellent. There we are. So, let me see. Wonder, there's a couple ways I could go about this. I think that I'm just going to take the hair, excess hair, and just braid and tie it out of the way. Take a little hair tie, little hair elastic. It's a little tougher to do this with gloves, but I think that'll about do it. Right, so that's a little easier to work with. And I'll do the same with the other side. Just to keep it out of the way. It's not going to be perfect, but this is just to hold it. Your hair is rather thick. Makes for a pretty braid though. There we are. You haven't noticed any hair loss or hair thinning at all, have you? Okay, very good. Just going to very gently to see if I can pin some of the hair back here. magnifying glass so that I can take a little bit of a closer look at that particular area. Are you noticing any pain or irritation with this at all? Okay. Well, I think really that looks like just some dry skin here. Not noticing a different color or any sort of growth. It's just a little patch back here. But it's better to have a closer look. Take our pins out and continue with the examination. Just about to the midline, and then I'll go to the other side. I'm going to check the hairline real quick, as oftentimes infestations or infections will lie around this area. But that all looks good. Very good. And turn your head so that I can see the other side. So, just going to be parting the hair. Yeah, looking at it. Just working section by section. Still comfortable so far? just going to check the crown of the head and just make doubly sure that there isn't anything out of the ordinary. Spin you around again. There we are. So now I think that I'm just going to unbraid and then comb out the hair. And now I just like to feel around your head. See if I noticed any lumps or bumps that I wouldn't have caught just from taking a closer look. Not noticing any lumps or bumps that shouldn't be there in the first place. just all the usual ones. So we'll get a little windswept, so I think that now would be a good time to comb out the hair. Use our comb. How's everything feeling so far? We do get that a lot. It feels like a nice little scalp massage, and you wouldn't really be expected to be treated like you were at the spa, essentially, but this really just helps our patients feel more calm, relaxed, and collected. Tends to just ease a bit of the anxiety or the worry, and then we can discuss anything that we found without having the added stress of just being at the doctor's. We're just we're bringing a nice calm environment. One is more apt to listen and digest the information that we give you if you're more in a calm, even state of mind. If you're already stressed out, it's kind of tough to really listen and understand what you need to do, any procedures you might need to do, any prescriptions that you might have to carry out. And then your scalp gets a lot of stimulation, so that always helps. Helps the hair growth, it helps your scalp bring healthy blood as you're promoting circulation. All in all, it's just a very easy thing to just bring the relaxation factor into it. It's not hard for me, and it's definitely not hard for you. I'm going to finish finish by just using our finest tooth comb. And then when we're finished with our combing, then we will discuss what I found and what you can do to improve your scalp's health and in turn your hair as well. Healthy scalp equals healthy hair for the most part. You are all combed out, so let me grab my clipboard and let's chat a little bit about what I found. So overall, your scalp health looked very healthy. We did talk about the product buildup a little bit, which again can be due to either products or it also can be environmental as well. And sometimes if your hair gets a little oily, that can help compound the problem as well. So using a clarifying shampoo might help that. I know Neutrogena makes a wonderful clarifying shampoo. I've used that myself a few times and it makes your hair feel squeaky clean. So you might just want to follow that up with a nice hair mask for the hair so that you're not stripping it too badly of hydration. Another thing you can do is to really rinse out the hair. And you might also think about using a little scalp massaging tool. I know you can find those for under $10 at quite a few retailers or online. And that'll help stimulate circulation and stimulate your scalp and help to aid in getting any residual shampoo or conditioner off the scalp. So otherwise, besides that little patch of dryness in the back, overall the scalp looked pretty well moisturized. So I know you were a little concerned about the dry scalp issue, and I think overall there's nothing like a fungal infection or an infestation or like scalp psoriasis, seborrheic dermatitis rather. I didn't see any evidence of that. So if you're concerned about the dry scalp, you may think about reducing your shampooing or your washing routine a little bit. So just depending on your hair, some people do well with washing once a day, other people do well with washing once a week. So just play around with it a little bit. For the first few weeks when you're trying a new washing routine, a lot of times your hair can feel overly greasy for a while, but it does tend to even out after a couple of weeks. So that might be a good time to bring out a nice hat or maybe a headscarf or something fun like that, or whatever you wish to do. Not go out of the house, you know, whatever you feel. So I think you really have a clean bill of health. So I'm just going to take a few notes here. Do you have any questions for me at all? Any questions or concerns? Okay. Well, if the problem gets worse, you can certainly give us a call and we can do a recheck of the scalp and see if there's anything going on. I might take samples of some of the skin on your scalp if there's still some issues going on, but otherwise then I would say you wouldn't have to come back for another year or so. Okay? Excellent. So I'm going to sign off. Here we go. And I think that will do it for us today, okay? All right. Thank you so much for coming into my clinic and getting a scalp examination today. Really appreciate having you here. I hope that you have a whale of a day and a good rest of your night. Thank you.